Hey everybody, my name is Brian Markowski, and today I'm going to be talking about how chlorpromazine was approved by the U.S. Food and Drug Administration in 1954. So first I'm going to mention a brief history of chlorpromazine prior to its introduction into the U.S. So first there is a drug similar to chlorpromazine known as promethazine, and this was synthesized in the 1940s by a French pharmaceutical company. Promethazine was known for its antihistaminic effects, or it helped with allergies, basically. However, in the early 1940s, they discovered it had major central nervous system side effects, and this kind of opened the door for chlorpromazine because they had to find a different drug to use because promethazine was too dangerous. So they discovered a similar drug known as chlorpromazine, and this had the antihistaminic effects they were looking for. It also had antiemetic effects, which helped with nausea. And most importantly, it had increased barbiturate effects, or CNS depressant. And this is the CNS effects is the main thing that they're going to use for the future. So in 1951, Henri Leberit, a famous French biologist, used chlorpromazine as an anesthetic for the first time. And this trial didn't really go too well because it put patients in a very detached vegetative state. And here is Henry in the top right. So chlorpromazine's introduction into the U.S. In 1954, it was approved by the U.S. Food and Drug Administration. And it quickly became popular in asylum medicine, especially patients with schizophrenia. And compared to other methods at the time, including like electroconvulsive shock therapy and lobotomies, this was seen as one of the most effective medications at the time, and it was shown to help bring mentally ill patients to a more, like, I guess, calmer state. And once the people working at the hospital saw this, they typically sent them back into the community. And this helped initiate the deinstitutionalization movement, which I'm going to mention in the next slide. So the deinstitutionalization movement was the movement of patients moving from mental hospitals to back into the community. And this was seen as financially advantageous by the federal government because it was a lot more cost effective to just give a patient this medication rather than constantly taking care of them in a mental hospital. And chlorpromazine was one of the main drugs that helped accomplish this task. And there were definitely mixed reports on the effectiveness of chlorpromazine. I read some articles that said that the patients were kind of forced to take the medication. It didn't really mention any of the negative side effects of chlorpromazine, and just the mentally ill patients didn't really have a say in the matter. So chlorpromazine is still used today. It's known as Thorazine. It's an antipsychotic medication, and it's still sometimes used to treat schizophrenia and bipolar disorders. It does this by acting as a dopamine antagonist, or something that prevents the buildup of dopamine, or the release of dopamine. And this kind of makes sense because schizophrenia and bipolar disorder are both known to be at least partially caused by the overactive dopamine receptors. And some side effects of chlorpromazine include sleepiness, weight gain, and tardive dyskinesia, or involuntary repetitive body movements. And because of especially the tardive dyskinesia side effect, they found that pretty dangerous, so it's used much less today than it was when it was initially introduced in the U.S., but it is still somewhat used today. Thank you for listening.